Have you ever felt unexplained fatigue that just won't go away? Today, we're diving into lupus symptoms to uncover what might be behind those mysterious signs. Lupus is an autoimmune disease where your body attacks its own tissues. It's tricky because symptoms can mimic other conditions, keeping you guessing. Let's start with fatigue. Over 80% of lupus patients report it as their top complaint. A 2018 study in Lupus Science and Medicine found it's linked to inflammation disrupting energy pathways. Ever wake up with stiff, swollen joints? That's another hallmark of lupus, often worse in the morning. Joint pain can feel like arthritis, but here's the twist. It rarely causes permanent damage. Research from the Journal of Rheumatology shows it's tied to immune complexes settling in joints. What about that rash across your cheeks? It's called a butterfly rash, seen in about 40% of lupus cases. This rash isn't just skin deep. It's a clue to systemic inflammation. A 2020 dermatology report study tied it to UV sensitivity triggering immune flares. Feeling feverish for no reason? Low-grade fevers are common in lupus, signaling your body's fighting itself. A clinical rheumatology study noted fevers often spike during flares, but here's the catch. They can vanish just as fast. Hair loss can hit hard too, leaving clumps in your brush. It's not just stress. Lupus can attack hair follicles. According to Arthritis Research and Therapy, this happens when inflammation disrupts the hair growth cycle. But can it grow back? Stick around. Chest pain when you breathe deeply? That could be pleurisy, where lupus inflames the lung lining. A 2019 Chest Journal study found it's more common in lupus than most think. Up to 60% may experience it. Ever heard of brain fog? Lupus can cloud your thinking, making focus a chore. The Lupus Journal reported cognitive issues in 20 to 50% of patients, linked to inflammation crossing the blood-brain barrier. Curious yet? Kidney issues are a silent threat. Lupus nephritis can sneak up without obvious signs. Blood or protein in urine might be your only clue. The Kidney International Journal says 1 in 3 lupus patients may develop it. So what's the warning sign to watch for? Photosensitivity is another red flag. Sunlight can trigger flares. Ever wonder why some rashes worsen outdoors? A 2021 Frontiers in Immunology study found UV light amps up immune attacks in lupus, making sunscreen a must. Mouth sores might seem minor, but they're a lupus clue, often painless yet persistent. The Oral Diseases Journal links them to mucosal inflammation. What ties all these symptoms together? They're unpredictable, flaring and fading without warning. Here's the big question. Could these signs point to lupus in you or someone you know? A Nature Reviews rheumatology study stresses early diagnosis is key. Lupus affects everyone differently. Women, especially aged 15, 44, are hit hardest. Why? Hormones may play a role, but the full answer's still unfolding. So, what's next if you spot these symptoms? Stay curious. Talk to a doctor for blood tests like ANA to dig deeper. Thanks for watching this deep dive into lupus symptoms. Your health's worth it. Please share, like, and subscribe for more health insights.